Hello, my name is Mary Sweeney, and today I'll be talking about the theory of reflection. John Dewey was the first educator to define reflection in 1938 as an active, persistent, and careful consideration of any belief or knowledge in the light of the grounds that support it and the further conclusive to which it tends. Terry Borton continued to build upon this thesis and coined the phrase, what, so what, and now what. Donald Schoen then talked about a reflective loop of action and stimulus in which the learner develops knowledge with little influence from the teacher. The evolution of the theory continued as David Kolb developed his cyclical theory of experimental learning. He described 4 phases: a concrete experience, reflective observation or review of the experience, abstract conceptualization, where the learner can develop new ideas or modifications, and active experimentation, where they can then apply those new ideas. The reflective cycle of growth and development with Q questions was then developed by Graham Gibbs. He talked about the description, the feelings, evaluation of what went wrong or what went right, and the analysis, conclusion, and action plan of how to apply it to future situations. Modern approaches continue to align reflective practice and experimental learning. Jennifer Moon continued to build and expand by linking existing knowledge to an analysis of the relationship between current experience and future action. Some limitations of this theory are that it's self-regulated learning, meaning that the learner has to be engaged, have a clear goal of reflection, and have high motivation. There may be difficulty applying the phases of reflection depending on the learner, and there's a need for instruction, framing, oversight, and feedback throughout the process. Reflective practice can apply to medicine as a way for us to make sense of complicated situations within patient care. There are 3 approaches to do so. The first is using reflection and learning when we utilize these phases of experimental learning to interpret and integrate our experience into our existing knowledge. This helps to create new and expanded knowledge. Reflection can also be used to develop a therapeutic relationship between the provider and a patient or caregiver. Reflection can also be used to develop professional practice in which we use our expert performance to create a complex integration of knowledge and skills. So some educational strategies that can be used to integrate the knowledge within our practice is guided reflection. This is when a mentor or supervisor can model the theory for a novice provider in order for them to see how the reflection can help their practice. So they can create a supportive environment to facilitate reflection. Ethical considerations also need to be made in that some of these experiences may elicit a strong reaction from the learner when they reflect upon them. An example may be dealing with a code situation where the patient expired, or perhaps the most recent COVID pandemic. Creating a safe environment to reflect, including a group setting or facilitation, may help with this. The learner also can be motivated and use several skills such as storytelling or writing. The last is the application to simulation. So utilizing this theory within simulation to optimize learning. Simulation typically creates a real-life scenario, and it can be done as procedural training or actual real-life scenarios that can help the provider's practice to perform better if they encounter them with real patients. There are 3 phases that are typically used within the debriefing portion of simulation. First, there's a pre-briefing, then the scenario, and then the debriefing. Within the debriefing, there's going to be a reaction where you're figuring out what impacted the learners, an analysis where the facilitator can use open-ended questions to discuss why or what happened during the simulation, and then a summary where we can apply the insight to the analysis itself. In a recent study with dental hygienists, the Kolb's theory was used to create a debriefing rubric framework called the Debriefing Reflection Rubric. And it was found to be successful in measuring a learner's level and quality of reflection during a simulation debriefing. So this is a potential to use the rubric in the future as a universal instrument for measuring learning. So hopefully you learned something from today's short video, but if you have any questions, here are my references, and I'm happy to talk in the discussion as well. Thank you so much.